question's got an interesting factoid in it. 30-year-old woman, lupus, and high-dose prednisone. Which of the following changes in white blood counts would you see? Try to answer this question on your own. Prednisone. Okay, what is prednisone? It's a corticosteroid. Steroids are used to suppress the immune system. And normally, neutrophils will stick to the blood vessel wall, margination. So it's like they're waiting on the sidelines, just sticking there for an infection. Steroids stop neutrophils from sticking. So the neutrophils are going to detach and re-enter the bloodstream in a process called demargination. And it looks like there are no more neutrophils in the blood. But they are actually, they're not actually working well. They're just floating around. So they're not going to be fighting infections properly, but so they're going to be like falsely elevated. That's why the steroids can increase infection rates despite increasing the neutrophil levels. Crazy, huh? And increased basophils. So those white blood cells, guys, those steroids decrease basophils by preventing histamine release, which reduces inflammation. Increased eosinophils. Steroids rapidly decrease eosinophils, and that's why they're used to treat asthma and allergic reactions. So, nope. Increased lymphocytes. Steroids lower them by triggering cell death and move them out of the blood and into the spleen and the lymph nodes. Increased monocytes. Wrong. Steroids decrease monocytes by preventing them from leaving the bloodstream to fight the infections. Right, so that's kind of the process here. So steroids cause neutrophil demargination, and steroids decrease lymphocytes, monocytes, eosinophils, and basophils. So they suppress the immune function. Monocytes, of course, large phagocytic white blood cells with simple oval nuclei and clear grayish cytoplasms. Eosinophils are the white blood cells that have the granules. And the basophils are just your basophilic white blood cell. So despite more neutrophils, the steroids actually are increased risk. So neutrophils are the first responders of the immune system. Most common white blood cell in the bloodstream. And their main job is to fight the bacteria and fungal infections by chomp, 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 eat the pathogens. And the lifespan is super short. And they work by traveling in the blood looking for an infection. When the infection happens, it signals the cytokines, tells the neutrophils to stop moving and stick to the blood walls. That's called margination. So cytokines tell neutrophils, hey guys, chill. Stop moving and stick around, marginate. Neutrophils then squeeze through the blood vessel walls in diapedesis. And they infect the tissue. And once inside the tissue, neutrophils kill the bacteria by phagocytosing, eating it, and releasing toxic enzymes in an oxidative burst. Calling for reinforcements, more immune cells. Come on, guys, come on. What happens when we take corticosteroids is, like prednisone, it affects the neutrophils by preventing them from leaving the bloodstream. Demargination. So neutrophils stick to blood vessel walls waiting for signals, but steroids block that process, and so they just detach and float. They're just floating. And so they're registered, but they're not helping. They're not fighting. And so, yeah, lymphocytes are going to be weakened T and B cell responses of higher risk. So decreased lymphocytes, decreased monocytes, decreased macrophages, decreased eosinophils, decreased basophils. Less allergic response, less antigen presented, less T and B. So neutrophils, remember those are the frontline people, and steroids will demarginate them, giving a false elevation, incommensurate with their actual utility. Hopefully this was helpful. If it was, like and subscribe. If it wasn't, then don't. Then get out of here.